We're getting your coronavirus questions answered by the experts in Boston. And Dr. Kristen Moffatt is in the Division of Infectious Diseases at Boston Children's Hospital. Thanks for being with us again.
Thanks,
it's good to see you. Over the last 2 weeks in Massachusetts, positive cases in people 19 and under, they have more than tripled to 700. So was that expected, or do you think that the virus is spreading more now among teens and kids?
I think that still fits with what would be expected. 700 cases in children under 19 of about the 32,000 cases in Massachusetts is still about 2% of cases, and that's very consistent with what we've seen out of larger reports of pediatric case percentages in other parts of the world and throughout the country. Okay. So I think as we're sort of hitting our stride with community-wide transmission, I think that is pretty much on course.
Okay, so that's good to know. All right, more studies are showing that people may be infectious before they show symptoms. So is that rare for a virus in general, and does it complicate efforts to contain COVID-19?
So I would say it's not terribly rare for a virus in general. If we think about maybe a virus that transmits in a similar way, like influenza, we know that people can be infectious with influenza at least 24 hours before they show symptoms. So 2 to 3 days before showing symptoms of SARS-CoV-2 or COVID-19 is maybe a little bit longer. And what it does do is definitely complicate some of the means in which we would try to control transmission, because it's certainly easier to really buckle down with keeping your distance and isolating yourself if you have symptoms and you therefore know to be that careful. So it really, really highlights the importance of all of the social distancing that we're doing and the extra hand hygiene that we're doing, even when we're feeling well.
Right. Absolutely. It is that time of year, the allergy season. If your child is experiencing allergies, or maybe they have another illness that you normally would have gone right to the doctor for, what should parents now think about doing, considering what's going on?
I think it's still most wise to touch base with your pediatrician by phone. A lot of pediatricians' offices are able to do virtual visits for concern like allergy symptoms over the phone. There are some symptoms of allergies, seasonal allergies, that might overlap with COVID-19 infection, for example. But a lot of the discussion you may have with the pediatrician over the phone about really teasing out those symptoms and what a child's history might be, if this really is the time and the symptoms are really consistent for that child to be having allergy symptoms, it may be that a virtual visit with a pediatrician could really help reassure that.
And so many people are doing that. It makes it a lot easier. All right, Dr. Kristen Moffatt, thanks so much for being with us again. Stay well.
Thanks. You too.